Hello, everyone. I'm Dr. Erwin Martinez Falier, your professor in San Pedro College, at the same time, the Director of Internationalization and Linkages in San Pedro College. So, welcome to our next course, which is actually our PH Care 203 on dispensing to, particularly on medication related problems, medication safety, medication counseling, and other pharmacy services. So this is a three-unit subject, 2 units for the lecture, and 1 unit for the laboratory per week. So all in all, we have 2 hours for the lecture, 3 hours for the laboratory per week. And this is actually for third-year student for the first semester. And the main course description of the subject will be this course deals with the application of the concepts of dispensing technique, and the ethical policies that govern this important facet of the professional practice of pharmacy. It also deals with the different prescription, order assessment, drug use review, design tailored fit counseling techniques to ensure medication safety. Let's try to have a walkthrough with regards to what will happen for this semester. So as we all know, on the week number 1, you will have a demonstration of the competence in the prescription analysis. So in the prescription analysis for week number 1, we're going to have a synchronous learning. A pre-recorded video will be given to you, and also a video viewing on the basic compounding techniques. After which, we're going to have a synchronous learning on the teaching activities such as the demonstration of medication order, prescription processes, at the same time also on tutorial or breakout rooms or group activities on the development or demonstration of the medication order or prescription. After which, we're going to have a laboratory for 30 minutes and then an orientation and a virtual laboratory on My Dispense and a pre-lab also on the first lab exercises. For our assessment for the first week, we're going to have a quiz for the second week via Creeper, and also the laboratory will also be in the second week for My Dispense assessment. And then there will be 3 prescriptions for 90 points. That will be part of our assessment for the following weeks. So this week will be more into an orientation, but then we will going to start with our prescription analysis. So looking with our syllabus here in the prescription analysis, for the second week, we're going to have asynchronous also about prescription analysis 2, and then synchronous learning on case-based learning, and then we're going to have our laboratory activities for the post-lab and the pre-lab for the second lab exercise. At the same time also for the My Dispense virtual simulation laboratory. And added up to that, we're going to use with a sterile simulation laboratory, which is very important for all of us for asynchronous learning. And I think we're going to use with our pharmacopoeia as part of our sterile simulation laboratory. For the following weeks, on week number 3 to week number 6, the topic will be focused on medication record, competence on the formulating effective patient care plans, and the teaching activities that we're going to have. Still, we're going to have asynchronous learning. There will be a pre-recorded video on patient care plan. I'm going to demonstrate to you what are some of the very basic fundamental patient care plan that we usually use as pharmacists. And then we're going to have synchronous learning. That will be a video case of different patient at the same time with a problem-based learning. So you're going to have a breakout sessions. You're going to have concept mapping for critical analysis on a certain problem. At the same time, also a case presentation on week number 5. So our laboratory activities will be tackling about post-lab and pre-lab on the second lab exercise. Asynchronous learning will be more into my dispense virtual simulation. So what are then the assessment? The assessments are the following. So in week number 4, take note, which week is it? The fourth week will be on quizzes via Creeper, and the problem-based learning will be on the third week and the fourth week also. So there will be a report given to me so that you will be able to be assessed. At the same time, also PBL individual assessment with the rubrics that we're going to follow. Now, in the 6 weeks, that will be a prelim examination. And then, of course, there will be a laboratory on week number 3, 4, and of course, week number 5. Okay, so on week number 6 is really on on the examination. That will be a prelim examination. Okay, on week number 7 to week number 8, 12 will be more into the demonstration of competence in evaluating medication-related problems and device solution following standard protocols. So on week number 7 to week number 12, still, we're going to have asynchronous learning on pre-recorded video on drug-related problems, and there will be a synchronous learning. A webinar will be given to you on certain experts in the field. Certain practitioners will be invited so that you'll be able to learn on in the industry basis. At the same time, we're going to have group learnings on week number 8, and of course, gamification and virtual patient counseling competition. So this will be a competition on the first My Dispense Olympiad on week number 10. Okay, so what will be our assessment for this would be we will going to have a lecture on week number 8 via Creeper, and of course the first SPC virtual patient counseling competition will be also held. At the same time also there will be video case, laboratory exercises will be given to you. At the same time also on that week, we will be also going to have our first synchronous My Dispense Olympiad. That will be 200 points. So you'll be competing with your classmates with different sections. And of course, there will be prizes that will be given to you for those who have get a particular score, no? A particular highest score for that. Okay, so that will be for our week number 7 and week number 12. Now, on the following weeks, we have week number 13 to week number 18. So take note, you still have your midterm examination. You will still have your final examination also. But in this week number 13 to week number 17, you'll be able to demonstrate competence in assessing physicochemical and therapeutic incompatibilities. So same as what we are doing, we were going to have asynchronous learning, a pre-recorded video on physicochemical therapeutic incompatibilities. We're going to have also synchronous learning. We're going to have gamification, knowing your drug, case-based learning, literature search on incompatibilities in dispensing on week number 15 and week number 16. At the same time, we're going to have tutorial in the preparation for week number 17 and week number 18. So there will be ample time for you to actually discuss basing on our examinations then. So our lecture will be on week number 14 and week 16 via Creeper, and then all examinations will be via also Creeper. So it will be time bounded. So take note that you'll be able to answer the examination on time for your prelim, midterm, and final examination. Okay, so in the week number 13 to week number 17, there will be a lot of laboratory exercises will be given to you, because on the following weeks, on week number 17, we're going to have our virtual My Dispense Bundle OSCE, or Objective Structured Clinical Examination. But beforehand, we're going to have our pre-OSCE or mock OSCE. At the same time, also, we're going to have our tutorials for this so that you'll be able to answer your exam perfectly. Okay, so I hope that at this time you'll be able to complete your dispensing number 2. Okay, but don't worry with that. We still have our laboratories. These laboratories will pre-lead you into your exercises for your final examination. So take note that this final examination for our My Dispense is actually also be recorded as your final exam, as your objective structured clinical examination on this. So this would be our basic reading. So you'll be able also to get in touch with Stockley drug interactions, pharmacotherapy, guide to clinical experience. So dispensing will be a new horizon for all of us to tackle also with clinical practice in a community setting and then also in the hospital setting, particularly on analyzing with prescriptions up to dealing with patients on their medication, side effect, medication safety, and all. No? So you'll be able to incorporate also your basic knowledge with pharmaceutics because it's very important how they're going to use with the device. What are some of the incompatibilities that we have for certain medication? There are extended readings also for Remington, Science and Practice of Pharmacy, RA 10918, our Pharmacy Act, at the same time, or RA 9165, the Comprehensive Dangerous Drug Act. At the same time, USP&F with the latest edition. At the same time, also the means. Now, there are also suggested videos and links for good pharmacy practice and also for FDA drug-drug interactions. You can actually look into Stockley. You can actually also upload it in your phone, which are a very good source also for Stockley for drug-drug interactions. And also there are some course requirements that we have like the quizzes, summative examination, summative assessment that we have, the graded oral recitations, the periodical exam, midterm, midterm and finals, the graded reports. These are the criteria that we usually have. The long examination, 40%. Quizzes will be 40%. Others will be 20%. Will be tackling about your recitation, your attendance, and of course some of your assignments. For the laboratory, there will be long examinations, 30%. Quizzes will be 30%. Others, like for example, your 40% will be laboratory performance report and product attendance. Okay, so this one will be talking about grading criteria. So that will really tackle on the assessment part. Okay, so I think that's all for our dispensing two. I hope and I pray that you will really enjoy for our class. And the enjoyment will always be there if you really participate and cooperate with the class and collaborate then in this virtual environment that we have. That to be all, I think. And see you this week with regards to our first topic on prescription analysis. Thank you very much and good day to all of you.